So let's get started. We'll start with Medical Monday. So on Mondays, we always try to bring you some accurate information about something in the medical world and things that people are talking about. And this past Monday, we talked about hydrochlorothiazide, which I will now call HCTZ for the rest of this article. But HCTZ is thiazide diuretic, commonly used to treat hypertension and edema. And it works by inhibiting sodium and chloride reabsorption in the distal convoluted tubules of the kidneys, promoting increased urine output. This diuretic effect helps reduce blood volume, thereby lowering blood pressure and decreasing fluid accumulation in tissues. And this is where it's really important to understand that not all blood pressure medicine is the same. So if your friend is taking a blood pressure medication and takes it at a certain time of day, or isn't supposed to take it with food, or is supposed to take it with food, there's all kinds of different types of blood pressure medicine, and this is just one of them. And these are the reasons why it's used: the management of hypertension or high blood pressure, the reduction of fluid overload. So the reason why you don't want a lot of fluid is that fluid retention actually impairs your heart being able to pump correctly. So we reduce the fluid, and then your heart can work easier and better. And prevention of complications. By managing blood pressure, you reduce the risk of other complications such as heart failure. But there are people who should not use HCTZ, and that is people with anuria. And those are people who already are having kidney issues. So obviously you would be talking to your doctor about that. And any kind of kidney function issues, you would not want to be on this medication. Or if you are already having trouble with electrolyte imbalances already in your system, such as issues with your potassium or having high calcium levels. And this is why it's important when your doctor asks you to have your blood levels tested. It's really important to continue to do that on a regular basis. They're not just doing it to bill your insurance. There is a reason for that. And then with any kind of medication, HCTZ does have some side effects that you have to watch for. And one of them is that electrolyte imbalance. And you will notice like muscle cramps, weakness, fatigue, a change in your heart rhythm. Those would be all important things to discuss with your doctor or to track. Dehydration or hypovolemia, which is the amount of fluid that's in your body. Hypotension, which is your decreasing your blood pressure too low. That happened to me one time on some medications, and I just felt like an amoeba. And it does take a little while for that medication to get out of your system. But yeah, hypotension is not fun. I literally felt like an amoeba. Hyperglycemia, which is higher blood sugar levels. So especially people with diabetes would want to check that if they are on this HCTZ medication. Hyperuricemia, which is the uric acid levels in your body, and this can lead to things like gout. And photosensitivity. So this is very, very common with a lot of medications. You can have a sunburn very easily being outside. But HCTZ is a vital medication for managing hypertension. It can also be combined with other blood pressure medications, but it's for hypertension and fluid retention in patients with aortic and heart diseases. Its ability to lower blood pressure and reduce the fluid overload can significantly benefit these patients, helping prevent complications and improve quality of life. But carefully monitoring is essential to avoid potential side effects and contradictions. And remember, it's always to always consult with your healthcare professional.